A few patients come to me and ask me why they need bariatric surgery or should they have bariatric surgery. To answer this question, patient can lose weight at any time. The bariatric surgery we offer the patient is the maintenance of the weight loss. So you not only lose the weight, but you also maintain your weight loss. The National Institute of Clinical Excellence in UK and the most recent research show that the patient can gain 10 years of their life back if the BMI, the body mass index, dropped from being overweight or morbidly obese down to a healthy BMI. So that's the reason actually people need the bariatric surgery, is to be healthier. So no more diabetes, no more hypertension, no more vessel disease, vascular disease, and obviously that can cause less heart attacks. And the most recent evidence show that weight loss surgery can even decrease incidence of cancers in the patient. And that's the reason people who need bariatric surgery should be offered. Patients always wonder what are the risks associated with having obesity surgery. And in comparison with other operations and with the advances of the surgical equipment and the medical knowledge, it's become a very safe surgery. So the chance of having complication, for example, is between 1 to 3% in comparison to major chest or abdominal surgeries. But there's a condition need to be implemented to make sure that the surgery will be safe, and there are mainly three. So the first one, we need a specialized hospital to do such operations. The second factor, we need a multidisciplinary team to deal with the patient. And that multidisciplinary team involves physician, a bariatric physician, a bariatric surgeon, and a bariatric nurse practitioner and a bariatric dietitian, all with the patient work in a partnership to achieve this target. And the third factor is the patient understanding and commitment for this life change. So to determine which is the best operation you can have is we need to study three main factors. So the first factor is the patient eating habits. The second question we need to understand is the patient past medical history or medical problems that he's suffering or she's suffering from, because that will affect the choice of the surgery. For example, if the patient has a significant gastroesophageal reflux disease, heartburn, reflux, regurgitations, vomiting, pain around the bottom part of the chest. For such a patient, offering sleeve gastrectomy or gastric band might not be the best choice. And the reason for that, when we construct the sleeve gastrectomy, we turn the stomach from a large sac with a low pressure system into a small tube with a high pressure system. And because it's a high pressure system, it will encourage the fluids to be refluxed back against a very weakened gastroesophageal junction. So that means the reflux is going to get much worse. And therefore, for such a patient, it may be better to avoid having sleeve gastrectomy. And another example, if we can imagine patient with inflammatory bowel disease like Crohn's or ulcerative colitis. For such a patient, when we offer them gastric bypass or mini gastric bypass, that might affect the nature and the progression of the disease, and also might affect further treatment option to that patient. And therefore, for such patients, better not to be provided with such options. The third factor is patient expectations and beliefs, what exactly they want to achieve out from this weight loss surgery. And for example, I have a patient came to me a few weeks ago asking for a gastric band, and they are sweet eaters, and therefore the gastric band might not be the best option for that patient. And she said to me, I want the gastric band because I think it's the safest option. And that's one of the misconceptions people think about the band. Band initially, in the first year after the operation, it is the safest. But the more you are with the band, the more chance of problem happening, specifically if you don't obey the rules of the band. So you might be facing with erosions, you might be facing with severe reflux or damage to the esophagus or damage to the stomach. And again, the more you are with the band, the more chance of this happening. While it's the other way around with the other two procedures, which is the sleeve and the bypass. So the more you are with the bypass and the sleeve, the safer you are. If the problem is going to happen, it usually happen earlier. In general, all the three operations are very safe. So to conclude, actually, we need to understand exactly patient eating habits, patient's understanding and commitment and believes what you want to achieve from the surgery. And the third thing is the patient's past medical history.